Hi, my name is Claudine Stadelman. I am 54 years old and I live in Aliso Viejo. I found out June 24th, 2014 that I have breast cancer. It was stage 1 and it was a surprise because I had gotten mammograms for, at that point, 12 years. He said I was going to be okay though, that the cancer was encapsulated and that they would be able to get it and everything would be okay.
What's good about having stage 1 breast cancer is that we have all kinds of options. And one of the main things that we talk about is that if we would like to save the breast, we have to do some kind of radiation, especially in a woman that's under 70. So since Claudine was under 70 by a lot, we really talked about the different ways to do radiation when we do a lumpectomy. Mobetron is really a good thing for patients with early breast cancer. And where it fits in patients with early breast cancer is especially when they're traumatized by the fact that they have breast cancer. And they're looking at a whole lot of treatment ahead of them. To tell them that the radiation can be done by the time they're done with surgery is a dramatic improvement.
I asked Dr. Carpenter, if you were in my shoes, what would you do? And she recommended the Mobetron IORT.
Because Mobetron uses electrons, and it's the most closely related to what we already do with external beam radiation, that if it were my breast and I had a small enough, most appropriate sized breast cancer to have, that it works, it's simple, it gives us really good, effective treatment. You know, Claudine and I have jobs and careers and lives, as do most women who have the diagnosis of breast cancer. And so what we want to do is we want to have the same effective treatment, but try to decrease the amount of time that we're away from our regular lives.
Well, actually, when I was first told about the radiation, I thought it would be a lot of radiation all at once, so that worried me a little bit. But then once I did research and spoke to Dr. Carpenter about it, I felt really good, and I was very happy with the outcome.
Radiation at the time of surgery has been very good for radiation oncologists, even if we were just doing it as a portion of the overall radiation to the entire breast. So I think we actually have an advantage that we're actually, either if we're using it in combination with the whole breast radiation or just single dose radiation, that we're getting it exactly where we need it to be.
So what I would say to other women with breast cancer is that when I had the IORT, I was sedated. I did not feel a thing. It was a one-time shot, and that the outcome was wonderful. I had no side effects. I would highly recommend it. My recovery was at home, and I was told I could take 2 or 3 weeks off. After a week, I was working. I was working from home. I had no side effects. I felt really good. I did not feel like I had had surgery.
What I love to tell patients about intraoperative radiation with Mobetron is that it is a very good option. And I like to tell them that they can have the same experience that Claudine had, that they can have one operation most of the time. They can be done with their radiation, and they can get on with whatever treatment is next.
St. Joseph's and Dr. Carpenter have been absolutely wonderful. I consider her a friend. I have had nothing but good relationships with all the doctors here at St. Joseph's. I highly recommend St. Joseph's, and I have to other friends. I don't feel like I ever had cancer.